We will start from new chapter, unit 3. So we'll start the topic which I'm going to present, that is autonomic nervous system pharmacology. In this chapter we will cover the different course objectives which is given already in your syllabus. So this is your course objectives. So in course objective we will cover these are the relevant topics. Differentiate the effects of stimulation of alpha and beta-adrenergic receptors, list characteristics of adrenergic and anti-adrenergic drugs in the term of effects on the body tissue, indication for use, adverse effects, nursing process implications, principle of therapy and observation of client's response. List commonly used over-the-counter preparation that contains adrenergic drugs. Discuss the principle of therapy and nursing process for using adrenergic and anti-adrenergic drugs. Discuss the nursing care, including the teaching client about the safe and effective use of these classes of drugs and calculate the drug dosage accurately. Now come toward the autonomic drugs. They are very much clinically relevant, as we know that before studying the pharmacology of various the drugs which can act upon on the sympathetic nervous system and parasympathetic nervous system and autonomic nervous system. So before this you will have to clear the basic concepts of the basic physiology of the nervous system, that what is nervous system, what is central nervous system, what is peripheral nervous system, what is brain, what is spinal cord. So then it will be easy part especially for all my students to understand these topics. Our main goal and objective is to learn about the drugs affecting the autonomic nervous system. Be prepared to learn mechanism of drug action with knowledge mainly of cardiovascular, anatomy, physiology and neurobiology to predict the effects of the drugs. Look at here. The autonomic drugs, as we know that the clinical indication of autonomic drug, they are used in the treatment of angina. Look at this patient, he is suffering from angina. As we know that autonomic nervous system or autonomic drug, they are used for the treatment of heart failures, CHF congestive heart failures. The autonomic drugs, they are used for the treatment of high blood pressures. So it means that autonomic drug, they are used in multiples, there are different clinical conditions. We can use it, keep a lid on high blood pressure. Autonomic drugs also used for the treatment of anaphylactic shock, which I have mentioned here, and septic shock and benign prostate hypertrophy in Alzheimer's disease and asthmatic patients. Now come toward the basic things, autonomic pharmacology and practicals. So in this slide I have mentioned mimics the nerves to organ O release neurotransmitter N and increase the activity of the organ O. So the look at here in this chart, this point is clear. What are neurotransmitters? So neurotransmitters, they may be in the form of acetylcholine. So for example, look at here, the drug A enhance the release of neurotransmitter N, which can be represented by capital letter N by acting on the receptor of N. Now look at here, drug A can increase the activity of the organ O. So these are the basic terminologies. It must be clear before studying the pharmacology of all the drugs which are related to the autonomic nervous system. So now come toward the block transmitters. So nerves to organ O, and it release the transmitter. It can be represented by capital N and increase the activity of organ O. The drug A blocks the receptor for neurotransmitters, that is N. Drug A decrease the activity of organ O. Understanding the actions of drugs that influence the autonomic nervous system allows the prediction of their effects. The first one is sympathetic nervous system and parasympathetic nervous system. So first of all, you will have to clear what is sympathetic nervous system and what is parasympathetic nervous system, and which condition the sympathetic nervous system can be activated, while in which conditions or in which condition the parasympathetic nervous system can be activated. So that's why I'm always focus this goal that you should know about the basic the physiology of the nervous system. After that, the pharmacotherapy are the drugs which are used, which can directly act upon on the sympathetic nervous system or parasympathetic nervous system. So this is very important. Parasympathetic nervous system, it releases the acetylcholine, which is the neurotransmitter, and it can increase the intestinal motility. While in second case, you know that atropine, it also come under the category of anti-cholinergic drugs. So atropine can block the muscarinic cholinergic receptor that responds to the acetylcholines. Physiologically, it is very important that we should maintain all the chemicals which are released from your body in a proper equilibrium. So let's suppose if we can take the example of acetylcholine. So we know this is neurotransmitter. So it must be under control. Let's suppose if the production of acetylcholine is high, so this is also not a good condition. Let's suppose if its production is low, so you will have to maintain all the condition. So I can give you a general example of, let's suppose we have different type of glands, like pituitary gland, which is called the master gland of the body, or hypophysis, and that gland is responsible to secrete different type of hormone. So the same case is here. So in this case, it means that we will stop or control the acetylcholine productions. So atropine, as we know that atropine, it come under the category of anticholinergic, which can block the acetylcholine receptor that may be muscarinic, and it can decrease the intestinal motility. For definite clinical outcomes, as I have already told you, that first of all you will have to create the basic concepts of the sympathetic nervous system and parasympathetic nervous systems. So in as we know that sympathetic nervous system, what are the activities which are under the control of sympathetic nervous system, and what are the activities which are under the control of parasympathetic nervous system. So the sympathetic nervous system release the noradrenalines, and noradrenaline, these are the hormone which is released by the adrenal gland, and it increase the blood pressure. While propranolol, it is the drug, we know that this is beta blocker. So simple propranolol, it is used against, it means that propranolol can directly act on sympathetic nervous system and block these particular receptor which is present in your heart. So there are two receptors which are present in your heart. One is beta 1 and the second one is beta 2. So this point is also clear. Beta 1 is the most dominant receptor which is present in the heart. So propranolol block that beta receptor, you can say beta-adrenergic receptor, that responds to what? That responds to noradrenaline. And as this point is also clear that propranolol, this is the drug which is used in the treatment of hypertension. So propranolol, it can block the beta-adrenergic receptor. Where are beta-adrenergic receptors? These receptors are present in your heart, and it decreases the blood pressure. Now come toward the organization of nervous system, that how the nervous system has been organized. So nervous system, it is classified into two categories. The first one is central nervous system, and the second one is peripheral nervous system. So central nervous system, we know that central nervous system, it consists of brain and spinal cord, while the central nervous system, that is called the body master control unit. As we know that central processing unit, CPU, which is already the basic component of computer. So in the same cases here, that the nervous system or central nervous system, that is called the body master control unit, while the second one is called peripheral nervous system. Now what is peripheral nervous system? So peripheral nervous system is actually the body linked to the outside world. So I am going to differentiate between the central nervous system and peripheral nervous system. So it means that central nervous system actually is the body master control units. All the activity, they are under the control of central nervous system, while other activities which are outsides, so the body linked to the outside world, that come under the category of peripheral nervous system. Now central nervous system is further categorized into three categories. The first one is spinal cord, brainstem, and brains. Now this is clear. Brain is divided into three parts. One is midbrain, hindbrain, and forebrain. It is divided into three parts. One is hindbrain, which is the lower part. The second one is midbrain, which is the middle part, and one is the forebrains. A brainstem, the basic function of brainstem, it connect brain to the spinal cord. Brainstem, so it connect brain to the spinal cord, while the spinal cord, the column of the nerves between the brain and peripheral nervous systems. Peripheral nervous system is further divided into what is autonomic peripheral nervous system, and the second one is somatic nervous system. The autonomic nervous system, it regulates the involuntary body process, including the heart rate, the body process, heart rate, respiration, digestion, pupil contraction, operate automatically without conscious direction. So they are under the control of autonomic nervous system. So it means that autonomic nervous system, they are not under our control. For example, we can say heartbeat, that is not in our control, respiration, they are not in your control, digestion, that is not in our control, pupil contraction, they are not in our control. So they are operate automatically without conscious direction. The second one is somatic nervous system. The somatic nervous system, it is related to your body system. So it carries the sensory information from sensory organs to the central nervous system, and then it relays the motor movements, commands to muscle and control the voluntary movements. Now it is further divided into two components. The autonomic nervous system is further divided into two. The first one is sympathetic nervous system, and the second one is parasympathetic nervous system. That's why I am focusing. I have told you that before studying the basic pharmacology of the drugs which can act upon on the central nervous system or peripheral nervous system, you will have to clear the basic physiology of the nervous system. After that, you can say that these drugs are used in the treatment of multiple diseases. Okay, so let's see here. The sympathetic nervous system actually that is responsible to prepare the body for action and stress, that is called fight or flight, while the second one is parasympathetic nervous system. So parasympathetic nervous system, it calms the body and help the body to conserve energy. Inshallah, in my next lecture, I will further categorize the nervous system, and then inshallah we will explain each and every drugs which can directly act upon on the sympathetic nervous system and sympathetic nervous system. So inshallah, thank you so much for watching my lecture.